Take a moment and think about every pill your parent takes every morning, the blood pressure medication, the cholesterol medication, the pill for the thyroid, the one the cardiologist added last year, the over-the-counter sleep aid they've been taking for months, the calcium supplement, the vitamin D, the fish oil. Now here's the question nobody has ever asked you. Has anyone looked at all of those together at the same time and assessed what they're doing to your parent's body in combination? For most families, the answer is no. And that gap, that absence of a single person looking at the whole picture, is quietly causing confusion, fatigue, falls, and hospitalizations in millions of older adults every single year. Today I'm going to give you the knowledge to close that gap, what to look for, what to ask, and exactly what to do this week to protect the person you love. Here's the fundamental problem, and I want you to understand it clearly because it explains why this happens even with good doctors and good intentions. When your parent sees the cardiologist, that doctor prescribes for the heart. When they see the rheumatologist, that doctor prescribes for the joints. The urologist prescribes for the bladder. The psychiatrist prescribes for mood or sleep. Each of these providers may have only partial visibility into what the others have prescribed. And nobody, in most cases, is sitting at a table looking at everything at once. Add to this, the aging body processes medications differently than a younger body. The liver metabolizes more slowly. The kidneys filter less efficiently. Body fat distribution changes, which affects how drugs are stored and released. A dose that was safe and appropriate at 60 may be too high at 75, not because the prescription was wrong then, but because the body has changed. And then there's the piece that almost never gets addressed: supplements. Patients don't mention them because they don't think of them as medicine. But St. John's wort interacts with antidepressants. Fish oil interacts with blood thinners. Calcium can block the absorption of thyroid medication if taken at the wrong time. Grapefruit, not even a supplement, just a fruit, interacts with statins and several heart medications in ways that can be clinically significant. The assumption most families operate under is this: if a doctor prescribed it, it's safe in combination with everything else. That assumption is dangerous. And today we're replacing it with something better. The first thing I want you to understand is called the prescribing cascade. And once you know what it looks like, you will see it everywhere. Here's how it works. A medication causes a side effect. The side effect looks like a new symptom. Instead of recognizing the side effect and adjusting the medication, a second medication is prescribed to treat the symptom. That second medication causes its own side effect. A third medication is added. The cascade continues. A very common example: an older adult is prescribed a blood pressure medication. The medication causes swollen ankles as a side effect. The swelling is mistaken for a new problem, and a diuretic is prescribed to reduce it. The diuretic causes dehydration. The dehydration causes confusion and fatigue. The confusion prompts an evaluation for dementia. The patient is now on 3 medications for what began as a side effect of one. Your job as a family member is to watch for this pattern. Any time a new symptom appears within weeks of a medication change, raise it explicitly with the doctor. The question to ask is simple: could this new symptom be a side effect of a medication? That question alone can stop a cascade before it starts. The second thing every family needs to know is that there is a publicly available resource called the Beers Criteria. It's published by the American Geriatric Society, and it is a list of medications that are considered potentially inappropriate for adults over 65, not because they're dangerous for everyone, but because the risk-benefit profile changes significantly with age. Many medications on this list are extremely commonly prescribed. Certain sleep aids, including some that are available over the counter, certain muscle relaxants, certain bladder medications, certain antihistamines that are in products your parent may take regularly without thinking of them as serious medications. Here's what I want you to do with this information. Go to the American Geriatric Society website and look up the Beers Criteria. It is free. It is publicly available. Print list. And at your parent's next appointment, ask the doctor directly, are any of my parents' current medications on the Beers Criteria list? Is that something we should revisit? You are not questioning the doctor's competence. You are being a good advocate, and a good doctor will welcome that question. The third issue I want to address is one that causes enormous distress to families and is almost always reversible when caught: medication-induced cognitive impairment. Many medications cause confusion, memory problems, slowed thinking, and personality changes in older adults. The classes most associated with this are anticholinergic medications, a broad category that includes many bladder medications, certain antidepressants, some antihistamines, and some drugs for nausea or stomach issues. Sleep medications, including benzodiazepines and the Z drugs like zolpidem, cause these effects as well. Certain steroids, certain pain medications. When an older adult's cognition changes, when they seem less sharp, more confused, more emotionally flat, the default assumption in many families is that it's the beginning of dementia, and sometimes it is. But sometimes it is entirely medication-related, and when the medication is adjusted or discontinued, the cognition improves. This is not rare. It is a well-documented, frequently missed phenomenon. And the difference between a reversible medication effect and the beginning of an irreversible neurodegenerative disease is something that deserves to be investigated, not assumed. If you've noticed cognitive changes in your parent after a medication was added or adjusted, that timing is important clinical information. Bring it to the doctor specifically. I noticed this change around the time this medication was started. I want to rule out a medication effect before we pursue a dementia workup. The fourth issue is blood pressure management, specifically the risk of treating blood pressure too aggressively in older adults. Guidelines for blood pressure management were largely developed in studies of middle-aged adults. The appropriate blood pressure target for a 55-year-old is not necessarily the appropriate target for an 80-year-old, because older adults are much more sensitive to the effects of blood pressure that is too low. When blood pressure is controlled too aggressively, or when a dose that was appropriate becomes too high, as the body ages, the result is orthostatic hypotension. This is a sudden, significant drop in blood pressure when the person stands up from a sitting or lying position. It causes dizziness, lightheadedness, and a brief window of unsteadiness that is one of the leading causes of falls in older adults. The question to bring to the doctor is this: given my parents' current age and overall health status, what should we actually be targeting for blood pressure? Has that target been reviewed recently? Is there any possibility that the current dosing is causing orthostatic hypotension? If your parent reports feeling dizzy when they stand up, if they grab for something, if they pause before moving after standing, that is a symptom that needs to be described exactly to the doctor with that specific language so it can be properly evaluated. The fifth and most actionable thing I want to give you today is the brown bag medication review. Here is what you do. You collect every single medication, supplement, vitamin, and over-the-counter product in the house. You put them all in a bag. You bring that bag to a pharmacist or to the primary care physician, and you say, "I would like a complete medication review. I want to know if there are any interactions. I want to know if any of these medications are on the Beers criteria. I want to know if any of them could be affecting balance, cognition, or blood pressure stability." Most pharmacies offer this service free of charge. It is called a medication reconciliation or medication therapy management review, depending on the pharmacy. It takes approximately 30 minutes, and it has the potential to identify risks that have been accumulating for years without anyone noticing. Do this once a year. Put it on the calendar. Make it as routine as a flu shot, because in terms of preventing hospitalizations, emergency room visits, and accelerated cognitive decline, it may be the single highest impact appointment your parents' healthcare year includes. I want to be direct with you about what happens when polypharmacy goes unaddressed, not to alarm you, but because the numbers deserve to be said out loud. Medication-related problems in older adults are estimated to cause over 700,000 emergency room visits annually in the United States. Many of these are preventable. Many of them result in hospitalizations, and hospitalizations in older adults carry their own serious risks. Hospital-acquired infections, muscle deconditioning from bed rest, delirium, and the disruption of every routine that was keeping the person stable at home. Beyond the acute events, the daily cost of undetected polypharmacy is enormous and invisible. Chronic fatigue that everyone chalks up to age, cognitive fog that nobody connects to the medication started 18 months ago, constipation, loss of appetite, persistent anxiety, disrupted sleep. These symptoms rob your parent of energy, engagement, and quality of life, often for years, when a single medication adjustment might restore function. This is not about blaming anyone. Doctors prescribing in good faith with incomplete information, patients managing more medications than any person can reasonably track, specialists who don't have access to each other's records. This is a systemic problem. But you, as a family member, are in a unique position to bridge it, because you see the whole picture, and now you have the tools to act on it. Here is what I want your family to do starting today. Today, make a complete list of every medication, supplement, and vitamin. Include the dose, the prescribing doctor if applicable, and how long it has been taken. Every single item, including the things your parent doesn't think of as medicine. This week, schedule a pharmacist medication review. Call the pharmacy and ask specifically for medication therapy management. Ask them to flag anything that may affect balance, blood pressure when standing, alertness, or cognition. Ask them to check the Beers criteria. This week, look up the Beers criteria yourself on the American Geriatric Society website. Check it against the medication list. Bring any findings to the next appointment as questions, not accusations. This month, request that the primary care physician serve as the medication quarterback, the single provider who reviews everything together, knows what every specialist has prescribed, and takes responsibility for the full picture. Ongoing. Any time a new symptom appears after a medication change, treat it as a possible side effect before treating it as a new condition. Ask the question before accepting the prescription. The power of what we've covered today is not about doubting the doctors in your parents' life. It's about recognizing that the healthcare system, as it exists right now, requires someone to hold the whole picture. In most families, that someone is you. You don't need a medical degree for this. You need a list, a pharmacist appointment, and the willingness to ask direct questions. That's it.